Hello, my name is Alyssa Williams, and today I will be presenting my Power of Workplace Civility and Diversity in Nursing presentation. And the name of this presentation is Enhancing Workplace Civility and Diversity. The first thing I will be covering is the workplace assessment. While reflecting back on my cultural competence assessment of my organization that we completed earlier in the semester, I was able to determine many strengths along with some weaknesses of this organization. When it comes to strengths of this organization, I was able to determine that cultural competence was a value of the organization. Appreciation was shown for cultural significant dates. Anti-discrimination was included within the recruiting process. Language services were openly promoted, and interpreters were available 24/7 for staff and patients. Cultural competence was also being covered during orientation. Staff inclusion was also covered, including positive attitudes, flexibility with staff, and strong anti-bullying policies and kindness were also covered during orientation processes. Weaknesses of this organization included the lack of a cultural competence plan for the organization. Also, a welcoming and warm physical environment was not necessarily displayed with pictures for staff and patients to see. Overall, though, this organization does represent true diversity and inclusion of all staff, including all races, ethnicities, and backgrounds. The action plan specific goal, also known as SMART goal, will be that over the next 4 months, 100% of staff will complete a workplace civility and diversity in-person training course, which will result in a 25% increase in inclusion and feelings of belonging reported by staff members on the unit. The milestones of this plan include 3 milestones. Milestone 1, also known as Month 1, we will be collecting data and evaluating the unit to determine weaknesses and strengths of diversity and cultural inclusion on the unit. We will also be promoting training courses to the staff and ensuring that adherence to signups is being done. With milestone 2, also known as month 2 and 3, we will then begin training and have incorporation of education videos, real life simulations, and we will be able to gain insight from the staff about how this new process is going for them. With milestone 3, or also known as month 4, this will be the completion of the training courses by staff that will be 100% done, and also a post-assessment will be given to staff to assess the impact or non-impact that the training courses gave to the unit as a whole. The evaluation of effectiveness for this plan will be measured by a comparison of the pre-assessments and post-assessments that were given to the staff members before and after the training programs. We will also monitor the incident reports pertaining to any incivility cases. We will also observe staff members' interactions with each other and patients. We will hold staff meetings to hear feedback about success of the training or worsening on the unit since the training. Then we will do a comparison of feedback and post assessments to the original SMART goal to ensure this plan is being done well. The leadership style that would best fit this new policy would be the transformational leadership style. A transformational leader is also known as being applied for this change by being a constant example for your staff about how civility and diversity should be displayed. They should be encouraging staff to be team players while being there for each other, giving staff members the opportunity to think about how they would approach a situation differently. We should be promoting accountability and supporting each staff member as an individual instead of as a whole. In summary, this change initiative will do nothing but increase the environment of this organization for all staff members and patients. With the incorporation of training courses, evaluations, assessments, and feedback sessions, this organization will be able to enhance their understanding of what it truly means to have civility and diversity inclusion within the workplace. With the cooperation of staff members and leaders within the organization, this change initiative will be beneficial for all involved. While creating my reflection and creating this project, I was able to do research further into what civility and diversity in the workplace truly means. This project and this class has both broadened my knowledge about diversity and inclusion and also how important it is to make sure every staff member or patient has what they need to feel included within the workplace. I feel that this is an important topic and this should be continuously discussed within workplaces. Overall, I have enjoyed this class and expanding my knowledge on important topics to be able to apply it to my future career as a nurse. And these are my two references, and thank you so much, and I hope you enjoyed.